Unintended or accidental injuries. You've all heard of them, and you've likely experienced them before. Hot glue gun burns, falling off ladders, phantom bruising, slipping in the shower, or tumbling while getting out of the bathtub. Heck, I've even stabbed myself with the handles of a bike before. Believe it or not, the CDC has reported that unintended injury is the third highest cause of death in the United States. In the year 2016 alone, 29.2 million individuals visited emergency institutions as a result of unintended injury. Of those 29.2 million, 161,374 resulted in death. 34,673 of these 161,374 deaths were from unintentional falls. Another 58,335 of these fatalities were the result of poisoning. A great majority of these injuries occur in the comfort of your own home. The 10 most common accidents in the home, according to the National Safety Council and other sources in agreement, are or are caused by the following: falling objects, trips and falls, bruises, sprains, cuts, burns, choking, poisoning, glass-related injuries, and drowning. Other common accidents in the home which may cause unintentional injury include, but are not limited to, motor vehicle crashes, fires, suffocation, and natural and environmental incidents.
We decided to take polls to find out which of these common household injuries were most familiar to the occupants of Great Mills High School, in order to help you understand and prevent future injury. According to the results, a majority of those polled have experienced bruising, burning, cuts, and falls in their home.
Bruising, often a result of falling, tripping, bumping into a desk, running into a wall, or some other form of blunt force trauma, is caused by the crushing of blood vessels under the surface of the skin. Because the skin is not broken, the blood under the skin sort of pools on the impacted area. This buildup results in discoloration, swelling, and pain associated with a common bruise. There are 3 general types of bruising which occur in the body: skin bruising, muscle bruising, and bone bruising. If you experience muscle bruising or bone bruising, it is recommended that you talk to a doctor or seek emergency medical care. In order to prevent bruising, consider some of the following. If you have stairs in your home, make sure that they remain clear of any objects that may cause someone to trip or fall. If you are operating a ladder, find someone that may be able to hold the base of the ladder in place, or, at the very least, spot you while you go up. While playing a sport or participating in a physical activity, be sure that you wear all of the appropriate safety equipment and avoid misuse of any other equipment involved in the activity. Above all else, be sure to watch where you are going when you are in motion. It may seem convenient, but walking while using a handheld device or reading a book are common activities that may lead to accidental blunt force trauma. If you happen to fall victim to a common bruise, ice the injured area and elevate the area above your heart to prevent unnecessary blood accumulation and the resulting swelling and discoloration. If by chance you fall victim to frequent bruising or phantom bruising from unknown causes, it is highly recommended that you talk to a doctor, as this bruising could be an indication of a blood disorder or other medical issue.
There are quite a few kinds of cuts: paper cuts, knife cuts, pencil stabs. Whether they are small or large cuts, they can cause different amounts of pain. Small cuts, like paper cuts, oftentimes hurt more. This is because of the placement of nerve receptors around the body. There are more pain receptors in your fingertips than most places in the body, and they contribute a lot to your sense of touch. However, that means that any injury to it has a possibility of hurting a lot. Small cuts, like paper cuts, hurt because they break the skin just enough to irritate those nerve endings. If small cuts, like paper cuts or scrapes, occur, wash the wound with soap and water, and cover the area with a Band-Aid in order to prevent possible infection. Cuts that are deeper, such as knife cuts, dog bites, and such, can be a lot worse. Oftentimes, stitches are required. Using good judgment from a trusted adult, decide whether or not to seek further medical attention. And now, burns.
Whether they are caused by heat, chemicals, electricity, or radiation from the sun, the results can be disastrous. According to the National Institute of General Medical Sciences, the most common burns are those caused by hot liquid or steam, building fires, and flammable liquids and gases. The severity of a burn is defined by how deep the burn is and how large an area it covers. The larger the burn, the more likely it is that the burn covers differing depths of skin.
First-degree burns, such as sunburns and hot glue gun burns, which hurt a lot, especially when they are located on your face or hands and all that jazz, are known for damaging the outer layer of skin, also known as the epidermis. Common first-degree burns may be prevented with use of sunscreen or heat protection devices, such as oven mitts, and they are frequently treated with aloe vera or other oils, creams, and ointments. Second-degree burns damage not only the epidermis of the skin, but also the layer beneath, called the dermis. A skin graft might be required in order to treat these burns, and may leave a scar. Third-degree burns may damage or completely destroy both the epidermis and the dermis. This damage and destruction could include the removal of hair follicles, sweat glands, and underlying tissues. The only way to treat third-degree burns is through use of a skin graft. Fourth-degree burns are burns that extend into the fat, while fifth-degree burns extend into the muscle, and sixth-degree burns extend to or into the bone. Deep burns are most difficult to treat, as they heal very slowly and are prone to infection, scarring, and other complications. Extremely deep burns are considered life-threatening and may require amputation.
While less severe burns may only cause redness, minor swelling, splotchy skin, blistering, and some pain, severe burns can lead to very serious body-wide problems. Oftentimes, these issues are linked to the body's inflammatory response. A majority of immune system responses are intended to destroy a problem's cause and clean up any remaining mess, but the body's response to severe burning often makes the injury more severe, harming the heart, lungs, blood vessels, kidneys, and other organ systems. When the body responds to a severe burn, there is often mass fluid loss, which results in a drop in blood pressure that could lead to shock, a life-threatening condition that occurs when the body is not getting enough blood flow, preventing proper oxygen and nutrient flow. Fluids may also become trapped in the body, causing a kind of swelling known as edema, which may worsen the already poor blood circulation. Oftentimes, tissues and organs may suffer damage or fail from lack of oxygen. The lungs, heart, brain, and kidneys are particularly susceptible to this organ failure. In order to prevent any serious injury, disease, infection, or other medical issue, treat any burns as soon as you become aware of them. Apply aloe vera, ointments, or medical creams to less severe burns, and clean the area frequently. If blisters appear, avoid popping them for as long as possible and immediately clean the area when popping occurs. Seek emergency medical assistance or call your doctor if you experience any of the following. Burns that cover the hands, feet, face, groin, buttocks, or any other major joint or large area of the body. Deep burns, burns which cause the skin to appear leathery, burns that appear charred or contain patches of black, brown, or white, burns caused by chemicals or electricity, difficulty breathing or burns to the airway, signs of infection, such as oozing from the wound, increased pain, redness, or swelling, a large burn or blister, or a burn or blister which does not heal within a week or two, new symptoms, or any unexplained scarring.
Now that you've learned a bit more about a variety of unintentional injuries, we hope that you are able to avoid, or at least treat, some of the common household injuries which you may encounter. Stay safe!